My name is Dr. Jody Guest. I'm an infectious disease epidemiologist and professor and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in harder hit communities across the state of Georgia, and I am the host for Emory COVID-19 videos, where we cover important topics about the COVID-19 pandemic. Today, I am very pleased to be joined by Dr. Andy Shane. Dr. Shane is the chief of the Division of Pediatric Infectious Diseases at Emory University School of Medicine and is the medical director of infectious diseases of Children's Healthcare of Atlanta. Good afternoon, Dr. Shane, and thank you so much for joining me today.
Good afternoon. It's a pleasure to be here. Thank you.
Thank you. We're going to be talking about pediatric cases of COVID-19 and the upcoming review of the Pfizer vaccine in younger children. First, we're going to go over some of our COVID-19 numbers and update through the second week of October. Currently, there are 57% of the US population is now fully vaccinated, and 66% of the US population has now received at least one dose of COVID-19 vaccines. Reports of new cases continue to trend steadily downward through the United States. And we, however, will reach 45 million cases of COVID-19 within the next few days. Currently, about 86,000 people are being identified as a new case of COVID-19 each day. However, this is down substantially from our high at the beginning of September, our high in the latest wave of COVID-19, which was approximately 160,000 new cases a day. While most of the country is rebounding from our summer surge, 96% of the country does still remain in higher substantial transmission categories and counties. Some trouble spots do remain. Colorado, Vermont, and Michigan are among a handful of states seeing sustained current growth. Alaska continues to lead the country in recent cases per capita, though case levels have started to decline in recent days. Anchorage, the state's largest city, recently approved a mask mandate after a much heated debate, and hopefully this will be part of the state's cooling off with COVID-19. Since October 14th, 16 to 17-year-olds have had the highest rate of new cases in the United States of COVID-19. This is followed very closely by 30 to 39-year-olds, then 12 to 15-year-olds, and then the age group we're going to be focusing on today, 5 to 11-year-olds. In many regions of the country, 5 to 11-year-olds do appear to be seeing cases rise, while 12 to 17-year-old cases are declining. Since the pandemic began, children represent 16.3% of the total cumulative number of cases of COVID-19. Last week, however, children were 25% of the new cases of COVID-19. For comparison, the same age group of children under the age of 18 make up 22% of the US population, showing a differential in risk for this age group. Today, we're going to be diving into the news of the FDA reviewing the data about vaccines for those who are 5 to 11 years of age in the United States and what the current pediatric cases look like in the US. The FDA, as a reminder, did authorize emergency use authorization of Pfizer vaccine for 12 to 15-year-olds in May. Since that time, 8.2 million children in that age group have received at least one dose, and more than 6.7 children in that age group have been fully vaccinated. So, Dr. Shane, later this month, the FDA is scheduled to consider Pfizer's application for emergency use authorization for children ages 5 to 11. What's that advisory panel going to be looking for when they first meet?
Yes, thanks, Jody. That's a great question. And, I think that the top of the mind issues always are safety and then effectiveness and efficacy, probably in this particular situation. And so those are really the main considerations of what we will be looking at in terms of the data that will be presented.
And so they're currently tentatively scheduled to discuss on October 26th, and that will be followed by a CDC advisory panel, which is also tentatively scheduled at this point in time. And those dates are November 2nd and 3rd, though it may shift around a bit. If the FDA approves Pfizer request and the CDC agrees, how soon do you think we might expect to see vaccines rolled out in this age group for our children?
Another great question. And, I think many of us would like as soon as possible, but there are some logistical challenges. And of course, this is all subject to what the FDA authorizes and what CDC approves. But at least the initial suggestion from Pfizer is that there's actually going to be a completely different formulation of the vaccine. As people may know, the dose that is being proposed for this age group is actually 1/3 of the dose that has been authorized or approved for older adolescents and adults. And so that creates some logistical challenges. One is which, and I think many people were thinking, well, since it's a multi-dose vial, we could just give 1/3. The problem is that the volume that ends up being is a very, very small amount, about 0.1 ml, which is really not adequate for an intramuscular injection. So therefore, Pfizer is planning to have a completely different formulation to be given to children who are 5 to 11 years of age. So that in itself is going to create some challenges in terms of distribution, supply, and also in many situations where clinics are giving vaccines to people of all ages. There's also going to be a different diluent that has been proposed. So some logistical and operational challenges with getting the vaccine and actually administering it. And of course, with all those, education is really a key part of this. So making sure that clinics that are administering a vaccine to children of different ages also are aware of how to do it for this 5 to 11 age group, if that's what is authorized. So I think all of us were hoping for an early Christmas present, but I'm not sure we're quite going to get there. Hopefully, if the ACIP and the CDC director agree with the recommendation to approve, to authorize, then hopefully by maybe the beginning of Thanksgiving or Christmas, we will have a vaccine available, at least being given to children. I think the other challenge also is to remember is this is being proposed as a 2-dose series. And so if we begin vaccination in the middle of November, that'll put some people getting their second dose around the winter holidays. And so just planning operationally for how all that will be done is going to be a little bit of a challenge. But I think at least in the pediatric community, we would take a vaccine with operational challenges any day over no vaccine.
Absolutely, I can understand that. And I was recently reading about the Georgia Department of Public Health is going to be hosting a bunch of educational opportunities for pediatricians across the state. So are you going to be hosting some of those at Children's Healthcare of Atlanta as well?
Absolutely, we were planning to at least administer and distribute the vaccine here to our patients. And of course, we always encourage community pediatricians and others to be the primary source of care. Vaccines should be administered in the medical home, but certainly for those children who we are the medical home, we want to offer that opportunity as well.
That's wonderful. So through the first week of October, talking about pediatric cases and the burden of disease among our children, there have been over 6 million children who've tested positive for COVID-19 during this entire pandemic. The number of new pediatric COVID cases does remain exceptionally high. And I showed some of that, or spoke about some of that data at the beginning, but there are over 148,000 cases that were added last week in the United States, and over 750,000 children were added as new COVID cases in the past 4 weeks, really showing the increasing risk that we're seeing in these kids. There are about 28 million children in this 5 to 11-year-old age group. And you've already talked about, a Christmas present for pediatricians to get this vaccine. How important does it feel to have this in your, in your armament to protect our children?
So I just can't say how important it is that we have a vaccine. We know with this pandemic that vaccination is the foundation. Obviously, there are mitigation methods that we also need to adhere to, but really having a vaccination has been instrumental, as we've seen, in preventing hospitalizations and deaths in adults and older children who have received them. We've taken care of over 7,000 children here at Children's Healthcare of Atlanta who have had COVID-19. Thankfully, most have been not required hospitalization, but of the ones who have, a number of them have been very severely affected. And I think that the most important point about this virus, Jody, is that we are learning a little bit about who is more susceptible for a severe infection, but we've also had a lot of surprises. And so really, we really want to emphasize that the children who have been vaccinated have really not required hospitalization and have not had severe infections. Most of them have been treated in an outpatient facility and have not required intensive care. And so really, vaccination does a tremendous job in preventing severe infections and hospitalizations, at least in children 12 and older who we've had some experience with.
Which is very much what we've seen in the adults, as well. So there are some who are still arguing that there isn't much risk of COVID-19 in younger children and that they rarely become severely ill with COVID-19. And data does support that there is perhaps less risk in children for becoming severely ill. But in August alone, across the United States, 30,000 children were hospitalized with COVID-19. And of the roughly 500 pediatric deaths that we've seen from COVID-19, about 25% of them were in this age group of 5 to 11-year-olds that we're now talking about a vaccine for. So why are people still saying that this is not a risk for children?
So I think that's a great question. And of course, what often happens, and we're used to this in pediatrics, is that we're compared to adults. And so obviously, the burden of clinical disease has been tremendous in adults. And when you look comparatively, you see, obviously, thankfully, many fewer deaths and fewer hospitalizations. But what we have seen is that since there has been vaccination available for older children and adults, we've now seen a shift in younger children having more severe disease and having infection. The other thing that has happened is that we have come sort of out of our quarantine state. Children have returned to school, mixing in the community. And so all those are factors that help to promote transmission of the virus among children. And I also think it's really important when we look at numbers to understand those, but also understand that behind every number there's a child. And it's not only the perhaps mild clinical disease that child might develop, but perhaps a post-infectious complication, for example, multisystem inflammatory disease in children, or MISC. And we've taken care of a number of children who have had that condition. And not also beyond the clinical post-infectious, we've had children who have developed what we call long COVID, or fatigue and other symptoms that have happened after a relatively mild infection. And so we're trying to understand how to predict who will be more susceptible to some of these post-inflammatory conditions. But once again, we're seeing a lot of variety and a lot of variability in that. And so another reason to be vaccinated, because that would prevent your opportunity for being infected in the first place. And then finally, children are really an integral part of society. And then when the rest of society is ill or is subject to a pandemic, children suffer in other ways that are not clinical, so behavioral, social, and we're starting just to see tremendous numbers of behavioral diagnoses in children who have been a victim of the pandemic, not necessarily clinical disease, but the societal disease.
The vaccine is a way for returning to normalcy in that normal childhood as well.
Absolutely. Yes.
You've mentioned some of the long-term side effects of having COVID-19 in children. Let's talk for a moment about some of the concerns with risks from COVID-19 vaccines. The Pfizer and Moderna vaccines have both been tied to increased risk of myocarditis and inflammation of the heart muscle, and pericarditis and inflammation of the lining around the heart, particularly in younger men aged 16 to 17-year-olds. And an FDA report recently estimated this might be about 1 in 5,000 boys in this age group. How big of a concern is this as an associated risk with COVID-19 vaccines?
Yes, thanks, Jody. Another great question. And I think, I would just start out by saying that everything we do, there's a risk and a benefit. And I would also say, having cared for a number of children who have had, COVID infection, and who have also had myocarditis, pericarditis from a natural infection, thinking about weighing those two different risks. And we're certainly seeing more severe myocarditis and pericarditis and other complications in adolescents, that same age group, who are subject to natural infection compared to those who have been vaccinated. We've taken care of a number of children who have had myocarditis and pericarditis after a vaccination. Thankfully, comparing that group to those who have had those complications after a natural infection, those who have had vaccine associated have really had shorter hospitalizations, we've been following them very closely and have not had some of the long-term effects that we have seen after a natural COVID infection. So obviously this is something we want to monitor and track very, very closely, but also thinking about those rates and thinking about the possibility of someone having a severe infection is also very important to weigh those risks and benefits.
Dr. Shane, I think one of the things you just did for us is so incredibly important. We talk about risks associated with vaccines, and the comparison of that same risk in COVID-19 for an unvaccinated person can be substantially more. And without that comparison, we're not getting the full story. So I really want to thank you for the way you tied those things together. We're going to move for a moment to while in this time period, while we wait for pediatric vaccines for 5 to 11-year-olds to hopefully be approved and certainly learn how to be logistically distributed, what can we do to protect these children as they're back in school and, very importantly, as we approach the flu season?
Yes, thanks. So a couple of things. First of all, just related to COVID, we still are seeing high rates in the community. We want to make sure that children are protected. So the first thing is that everybody who is age eligible in a child's household should be vaccinated against COVID. The second is continuation of masking. We have tremendous amount of evidence, accumulated evidence, that in those schools where universal masking is practiced, we definitely have decreased rates of inter-school transmission of COVID-19. And so that really is a very important, universal masking is very, very important. Also making sure that we don't forget about basic things like hand hygiene and physical distancing when appropriate. And also thinking about individual risks. Perhaps traveling right now may not be the best option for somebody in a family where there may be unprotected people. So those mitigation risks are really important, and it's hard. We're human. We get tired of doing things. Nobody likes wearing masks, but really encouraging children to continue to adhere to those practices. And as adults, even though we're vaccinated, being a model for our children, because they like to imitate what we do. And so I think that that's really important. The other thing is we are entering the influenza season. And so we really encourage everybody 6 months of age and older to receive a flu vaccination. And we usually say boo to the flu, which means get your vaccination before Halloween. For some children under the age of 8 who have previously only had 1 dose of flu vaccine or no doses, they will require 2 doses separated by 4 weeks. So even more important for those younger children to begin their flu vaccination series as early as possible. And then encouraging everybody in the household to have influenza vaccination. It's very difficult to differentiate sometimes between influenza and COVID-19. And so if you're vaccinated against influenza, there's a high chance that you will not have influenza if you develop respiratory symptoms, and it could be something else.
There's a lot of nice new data also about the fact that you can get your flu vaccine at the same time you get your COVID-19 vaccine if you're in the age group where you can get one. But for those who are under the age of COVID-19 vaccine eligibility currently, start your flu vaccines as soon as possible.
Absolutely, yes.
So let's talk for a moment about mixed age households. So we already have households with children who are 12 and older who are eligible to get vaccinated, and and younger kids who are not. When we get vaccines down to our 5 to 11-year-olds, what do we want to continue to do in these households to protect even younger children who are not yet eligible to get COVID-19 vaccines?
Yes, a great question. And I think one that comes up a lot from families that I take care of. And, once again, I think one has to look at who is the most risk in the household and structure activities among that greatest risk, so to speak, person. And so I think that relates to travel, that relates to interaction, social gatherings, and other situations where you want to consider that you do have people who may not be protected in the household. That also applies potentially to older people who are immunocompromised and may also not have a completely robust immune response. So I think thinking about who is at the greatest risk in the household and structuring activities around thinking about and considering that individual.
So important. We need to continually discuss the fact that our connection to each other is both the beautiful part of our world and society, but also where our risk for COVID-19 is so shared. And so we need to continue to remember that my vaccination protects the people around me. My mask helps with people around me as well. Dr. Shane, let's end with, what would you say to a parent who would be on the fence about getting a COVID-19 vaccine for their children, either the 5 to 11-year-olds that we're waiting for approval for, or even our 12 to 17-year-olds who are currently now eligible to get COVID-19 vaccines?
Another great question. I think that it's really important, Jody, when we're thinking about vaccine hesitancy or concerns about vaccines, to understand why someone has that opinion or question. This is not a one-size-fits-all approach. And so really trying to target your response to, and I try to target my response to what someone's concern is. So as I mentioned, and we talked about in the beginning, the FDA is going to be looking at safety, and they're going to be looking at efficacy or immune response. And so somebody may have a concern about one and not the other, or both. And so I think that it's really important to understand where that concern is coming from and trying to address those guidance and recommendations to that specific concern. I would also encourage people, I think it's really important to do your own research, to use reliable sources. The CDC, the Georgia Department of Public Health, Emory has developed a number of resources. Children's Healthcare of Atlanta has a number of resources as well. And to really think about and read and understand, and a lot of questions will be answered in that reading. And then, to really rely on reliable sources. But I do want to just say that, I think that vaccines really are our passport out of this pandemic. And the more people we can get vaccinated, the better we will be, both in terms of preventing infections, preventing hospitalizations, and preventing deaths, and enabling us to really return to a society where we can all be together as individuals and as a community.
Dr. Shane, thank you so much for joining me today. It is incredibly important for everyone watching to remember we are fast approaching our flu season. Now is the time to get your flu shot. But we were really here today to talk about COVID-19 vaccines in our pediatric population and our excitement about the fact that they are hopefully coming our way for 5 to 11-year-olds, and that is a large number of people in the United States who will then become eligible for COVID-19 vaccine and the protection that they afford all of us. So thank you everyone for watching today. Dr. Shane, thank you so much for your expertise.
Thank you, my pleasure.